Have you heard of CBD? Do you know someone that's using it, or are you using it yourself? Are you aware of what side effects to look for? Did you know that there are drug and food interactions that may happen with CBD? Today I will examine these subjects so that you can make wise choices when deciding whether or not to use this popular substance. By subscribing to my channel and hitting that little bell, you will be notified every Monday when I post a new video that will help you navigate the sometimes confusing healthcare system. In my practice as a pharmacist, I help patients each day make wise decisions as to whether or not CBD is a good choice for them. In this second video about CBD, we are looking at who should maybe not be using it, or at least using it with caution. Lately, CBD has become the latest fad. Because it's sold over the counter, which means you can buy it without a prescription, many people believe that it's got to be safe for everyone, right? Wrong. Just because a product doesn't require a prescription doesn't mean that it's safe for everyone. This applies to all OTC or over-the-counter medications. First, CBD can be hard on your liver. So if you've ever been told that you have liver damage or liver disease, you should probably stay away from CBD, or at least consult with your physician so he can monitor your liver function. All medications and supplements have the potential to be harmful to someone. Some people are allergic. Some people have health conditions that prevent them from taking specific over-the-counter products, such as people with liver disease should not be taking acetaminophen products. Some people take prescription medications that interact with over-the-counter products, such as blood pressure medications and decongestants. Any substance you put into your body has the potential to cause an unwanted side effect or interact with other substances, so you need to be educated to keep yourself safe. So, what are the common side effects of CBD? Used topically, if you are sensitive to any ingredient in the cream, you can develop a rash. Even if you aren't allergic to the CBD itself, you might be allergic to an inactive ingredient present in the cream. Since CBD used topically doesn't get into the bloodstream, there are no drug interactions. Though it's usually well tolerated, CBD has been reported to cause side effects such as dry mouth, diarrhea, decreased appetite, drowsiness, and tiredness. Worsening depression and suicidal thoughts were also reported. And there are drug and food interactions associated with taking CBD orally. Because CBD is metabolized by the liver, other medications that are metabolized by the same pathway may be affected by CBD. CBD alone can cause liver damage, but when it is used at the same time as other substances that can be hard on your liver, this increases your risk. If you have liver disease, you should avoid using oral or sublingual CBD unless you are being monitored by your physician. Also, patients with a history of suicidal thoughts should avoid CBD altogether. Do not use CBD if you are taking the following medications unless you are being supervised by your physician. Alcohol increases the risk of liver damage. When taken with alprazolam, you can get increased dizziness, drowsiness, and confusion. Naproxen can increase liver damage. So can Cymbalta. So can Tylenol or acetaminophen. Medications that when taken with CBD cause increased dizziness and drowsiness and possibly confusion include Benadryl, Lyrica, Zoloft, and Zyrtec. These are just a few of the reported drug interactions. A complete list of the suspected drug interactions can be found on drugs.com, and I will link that page in the description below. Have you ever tried CBD? What did you use it for, and what were your results? Tell us about your experiences with CBD, either good or bad, in the comments below. Grapefruit should also be consumed with caution if using CBD because it may increase the concentration of CBD in the bloodstream. If swallowing CBD oil instead of using it under the tongue, if you take it with a high-fat meal, you may get increased absorption. To stabilize the CBD levels in your system, you should take CBD at the same time every day and consistently take it either with or without food. CBD may also increase the blood thinning effects of warfarin or Coumadin due to the interference with the metabolism of warfarin. CBD should not be taken unless under the direct supervision of your physician if you are on warfarin. Extra INR tests may be necessary for you to take CBD with warfarin. You may also get increased blood thinning if you are taking ibuprofen or naproxen, which are available over the counter. While the occasional dose of ibuprofen or naproxen with CBD will probably not cause a problem, if you notice increased bruising or bleeding, you should probably stop the ibuprofen or naproxen or stop the CBD. Before taking CBD or any over-the-counter medication, you should have your pharmacist go over all of your medications to ensure that CBD is safe for you. If you think this information has been helpful, please give it a thumbs up and share it with your friends. And if you have any questions about CBD, leave them in the comments below and I'll do my best to answer them. I hope this video has answered some of your questions about what side effects and interactions you should be aware of if you're using CBD. Thank you for joining me today. Have a blessed week.